Hi, this is Brian Wormers. I'm going to talk to you right now about the clinical experience poster submission and what that's going to all entail for you. So for this, the goal of completing this nursing program is having excellence in practice, and your capstone is supposed to be a great time for you to expand and have great clinical experiences. So within this, you're going to do a poster presentation regarding your experience. So you're going to pick one particular patient that you had and do kind of a case study on it. And so you're going to have some requirements, as we're going to cover here below, but realize that that's what this is. So this is going to be a case study in a poster presentation. So within this, you're going to have a complex patient or some kind of an interesting patient that you want to talk about. You're going to talk about patient history. Reminder, do not break HIPAA. If you break HIPAA, you will get a 0 for this assignment, and nobody wants that. So make sure that you are not giving any patient identification. Make sure that you are not, no real names, no birth dates, not where they come from. You're going to be like, a patient on a medical surgical unit in the Midwest was seen for this, this, and this. You don't want to be too precise or specific. Don't be given like name, rank, social security number, etc., or give a lot of details in which somebody from a small town could identify your patient. So make sure that you follow the HIPAA, do not break HIPAA. But you will get into a patient history. So, tell them a little bit about their background, a little bit about their, ethnicity or whatever matters in your patient situation. Tell them about the presenting illness, primary and secondary diagnosis or more, and then family history, medication history, nutritional history, and functional assessment. So how did this impact your patient's overall health? What were the physical findings? What were normal? What were abnormals? Were labs done? Were diagnostics done? What medications were they on? How does that all fit in together on your patient? Were there any complications related to any of those? For your diagnosis, give the top 3. Make sure that this is the top 3 for your patient. Do not use the standard stuff of, patient at risk for falls because they're in the hospital, or patient at risk for bed sores and skin integrity because they're laying in bed. Yes, while those are real, yes, those are things that we do need to consider as nurses. Those are probably not your top priority. Really tailor it to your patient and really get, what's truly important for your patient. Within this, make sure that one of those is a psychosocial diagnosis. So within this, you're going to have some planning and outcomes. How did this patient, progress? What are their priority needs? What did you all do? Within this, have SMART goals, so specific, measurable, achievable, relevant, and have a time frame for it. And then have 2 per nursing diagnoses. So since you got 3 nursing diagnoses, you're going to have 6 goals. 2 of which are going to be related to psychosocial. Implementation. What were some of the things that you were related to the diagnosis and outcome of your patient? What health promotion, disease prevention considerations were implemented? What cultural considerations were implemented? This can be anything from they were Catholic and they wanted a priest to come, or they were Lakota and they wanted sage, or they wanted to be facing a certain direction, or there's lots of different things you can use. Make sure you have some cultural considerations with this. And then who was all involved with coordination of cares? I'm guessing provider, RT, speech, PT, OT, case management, etc., etc., etc. So, talk about that coordination of care, who's all involved, what your role was. And then evaluation. Was it effective? As you go through this, you're going to realize that sometimes this is beyond your control, and just because it wasn't effective or they didn't hit the goals that you had set for them doesn't mean that that's something that you did wrong. So within this, were they effective? Yes or no? And if so, great. Either way, is there anything that you would have changed about it? So just kind of go into this, and then was it achieved or not? And if not, then what did you change it to? Or what were your next steps? Or even if it was, then what were some of your next steps? So just kind of look at your patient identification or your patient's history and what's going on with them, and kind of wrap it up as a nice case study. So as we look at this, the poster presentation in and of itself, you've got this link. Please use this one and then save it as a PDF. The place where we take these want this as a PDF, so please don't make me change it, because then sometimes your formatting gets messed up. So when you submit it, make sure that you're submitting it by January 31st at 8 a.m. in a PDF file onto the LMS. But you're going to cover all those things that we just talked about: background, nursing assessment, nursing diagnosis, planning, implementation, evaluation. If you want to add some images on here and they're appropriate, that's fine. Just make sure that it's nothing that will, break HIPAA or do those kind of things. Tied to that, we do have a rubric for you to follow, and this is how you're going to get graded on this experience. So for this, we talked about nursing assessment. What was the physical findings? What medications were they on? What are the diagnostics? For your nursing diagnoses, what are your 3 main diagnoses that you have for this patient? At least one of them's got to be psychosocial, like we talked about. What's your planning? What's your goals? We talked about having those SMART goals, and make sure that you utilize those, and make sure you word it in those kind of terms. And make sure that one of these is going to be, 2 for every one of your nursing diagnoses. And then so 2 of them are going to be based on your psychosocial diagnoses, at least. You can always have more, but those are your minimums. Going into your implementation, so within this, it is looking at your nursing diagnosis, your outcomes, what health promotion was done, what's your cultural consideration for this, and coordination of care. So speak to all these different issues, make sure that you cover them. For your evaluation, what did you do? Would you change anything? Were they effective? Were they not? Was that all right? Like I said before, if you set a goal and you don't hit it, that's all right. That's maybe not anything that you've done wrong, or you didn't fail as a nurse. So going on with this one, graphics, visual appeal. So this is a poster presentation. It does have to have great information on it, things that you can use to guide the person that you're presenting to. Make sure that it's grammatically well developed. Make sure that there's no spelling errors. Make sure it's visually pleasing. Make sure you have references that you can either hand out, which is my recommendation, or that you list on the poster. Keep that poster the same size. Don't change that. And then we will print that off for you. But yeah, you've done posters before, so just make sure that it's a good poster. And then presentation, when you present, make sure that you have professional delivery. Make sure that you're dressed appropriately. Make sure that you're speaking correctly. Make sure you're using appropriate terms and in a professional communication style. And lastly, make sure that your presentation that you're recording is less than 10 minutes in duration. So as a kind of rehash, on January 31st at 8 a.m., you need to submit your poster in a PDF form onto the LMS. I'll take that, print that off, and get that back to you. Before you actually present on February 4th at noon, you need to have an uploaded recording of your presentation that is less than 10 minutes in duration that the faculty can use to grade you and grade this assignment. So I think that covers all the major aspects of this. Just if you have any questions, please reach out to us and talk to us, as we are happy to help you with this. So I think it's going to be a fun assignment. I hope you have a great experience in Capstone, and I can't wait to look at these. They're always so much fun to see what you've all done and what you've accomplished in your career so far.